health and care in Cambridgeshire. Scarlett.
Thank you so much, and thank you so much for the invitation, everybody. As was mentioned, I am an independent researcher, but I'm here today to talk on behalf of the work of and it's a long title, so I'll say it all, the Cambridgeshire and Peterborough Independent Commission on Public Service Reform. It does not have a snappy acronym, but please, if you do have any ideas, do send them over. This was a commission that was put together by the Mayor of the Cambridgeshire and Peterborough Combined Authority, and I was the research support for that work. So for the best part of, in fact, I think it was nearly 2 years by the time we were finished, we did a major piece of work for the Mayor in looking at how we might think about innovative ways to look at health within this region. I mean, it was a really interesting project, and I'll obviously pick up on lots of the recommendations that we made over the course of the next hour of the session. But just to give you a bit of background, so our kind of the headline message was we needed to look at how we can look at innovation around public services with a specific focus on health. So over the course of the time, I was interviewing and speaking with many people within that region about what we might be able to do. And of course, you know, when you start talking to people both within public services and with some kind of responsibility for the health of people, and you say to them, you know, what would you do better in this region? How could we make things better? You end up talking about one of two things. One is integration and the other is prevention. And it's very difficult to have a conversation about health in any concept without covering those two things. So one of the real privileges of the work that the Commission was doing, and I say it was a privilege, not just because several of the commissioners are on today's call, so I want to be nice to them, but it was an extremely kind of holistic approach. The group were not necessarily experts within public services themselves, and so we were taking a really holistic approach to what we might call, you know, very broad definition, both of prevention and of integration, and looking at the ways that we might be able to achieve both of those things, both in terms of things we might be able to do, but also trying to knock down some of the barriers to this. And I think, you know, it was mentioned at the beginning, but, you know, the concept of integration being the solution is in no way a new one. And in fact, many of the people that we spoke to over the course of the 18 months were very tired of conversations about integration. And many of them felt that they'd been doing it in this best way they could within the confines of the complicatedness of the system. And so a kind of another group of people coming in to ask them about integration kind of felt slightly like overkill. So some really interesting challenges that this threw up. The 4 kind of key messages that we came up with, in fact, before I go into that, I think the other thing that was really interesting about this programme is that we were due to publish the final report of the work of the Commission around about April of 2020. And so we were just putting the final touches on the final report in about May 2020, and then the entire world shifted. And we suddenly had on our hands a completely different landscape within which to discuss integration, health and prevention. And some of the more radical ideas that we might have had within that report suddenly became things that were not only not radical, but that were happening very quickly. So we extended the deadline of the work of the Commission and ended up publishing finally in October 2020, being able to speak to people during the kind of the response, the first response to the lockdown, and how the organisations were really dealing with this. And what we really found was that some of the things that we'd suggested went from being radical to being done overnight. Digital innovation strategies that had been 10 years in the making suddenly had to happen, and the integration and the speed with which the local authorities and the NHS had to work together was just unbelievable and inspiring. And at that time, there was a real spirit of hope, I think, that this could be something that could continue. I will talk lots, I'm sure, over the course of the next hour about the things that we learned, but just to sort of emphasise the key kind of 4 messages that came out of that piece of work, and where we were sort of emphasising to the Mayor he might be able to make a difference, was first taking a holistic and systemic approach to health. This included a very strong message about the reduction of inequality, and this kind of tying within a wider economic framework that you cannot have a wealthy region without having a healthy region. and the kind of levelling up agenda, again, something that we're going to be talking about a lot at the moment. The second was to build on success already within the region rather than disrupting it. There is, in almost every region across the UK, I'm sure, fantastic teams doing a huge amount of work on trying to integrate and work together. And there were some amazing examples within the region that we were talking to about areas where it was working really well, and a real sense that we didn't want a kind of slightly higher up, more centralised body coming in and changing everything. So kind of building on the success from the bottom up was a really important part. The third was to focus on long-term investment, not cost. This is a region that was, as many areas are, funding-wise, was facing issues, and we really found that funding problems suck the air out of a room and really are a barrier to even talking about innovation and change. And again, it was incredible seeing what happened during the COVID time when the financial pressures were taken off, even for 5 minutes, and local authorities and local health providers were given the all clear to spend what you need to spend to keep people healthy. And of course, they didn't overspend, weren't spending huge amounts of money, but the funding problem was taken out of the room, and suddenly they were able to do things that they knew were going to make a difference. And then the fourth key message was that the answer is in almost every level local. We really found that the more localized approaches were those with the most successful, and that will not be something that is new to anybody that's worked in this area, but that actually the more that things could be done from the local up, they could be done from the person backwards, and start with what things really work on the ground on an individual level. And of course, again, this is an area where district councils, but also the third sector and other different kinds of organisations really know their people best, and again, something that we saw quite strongly within the response to COVID. So those were the four key messages. We were looking at it along a whole bunch of levels, and like I say, look forward to the discussion and answering more questions around it. But it was a fascinating piece and something that I really hope we might be able to see it. I felt extremely optimistic during the summer, which is an unusual thing to say during a global pandemic, but the potential for things that could be continued post-COVID, if there ever is to be a post-COVID, and the ambition and hope within the organisations that this might be a route to integration. 6 months on, it feels a lot more difficult now. I think, organisations are exhausted, our patience is exhausted, and I think some part of this has to be, how do we go back to or bring in some of that optimism we had at the beginning about the potential for integration and for providing good care. So that's a big part of what I would love to say the future of it is can we get some part of that optimism back, even if it's only temporarily.